Okay, so I think most people on the call are probably pretty familiar with IARPC, but I did want to go through and give sort of a brief background to IARPC and to sort of the previous research plan and the health and well-being collaboration team, and then get into the next plan. So I think we can go on to the next slide, Meredith. So IARPC, I think folks know this, but it is the Interagency Arctic Research Policy. It was designed to increase collaboration across federal agencies in regards to research in the Arctic, and was established by the executive branch of the federal government. And in addition to the goal of collaborating across federal agencies, we're also trying to collaborate with our non-federal partners on Arctic research, as well as I think in this plan too, there's more of an emphasis of trying to reach out to Arctic communities and residents themselves. So part of the agenda today is just to get feedback on sort of where we're at in the research planning process. And we'll be doing that through some Jamboards towards the end of this orientation. So next slide, please. So I just thought it's useful to sort of remind ourselves about the breadth of IARPC and who all is involved. So at the top here is the federal agencies that are involved. And then at the bottom is the non-federal partners. So, the agencies are too numerous to be listed, but in the human health realm, I think some of the agencies that have been involved in the past are the Smithsonian Institute, the Centers for Disease Control, the National Institutes of Health, as well as the Denali Commission has all now joined IARPC, and then our sister sort of organization, the U.S. Arctic Research Commission, has also been very involved in health research in the past. And then at the bottom are the non-federal partners that have historically been involved, particularly with the health and well-being collaboration team. So those have involved, numerous departments from the state of Alaska, the Department of Health and Human Services, the Department of Fish and Game has been involved in public safety, as well as ANTHC and many of the regional health corporations. And then, the Alaska universities have been involved. And then the Alaska Rural Water and Sanitation Group, as well as the Alaska Energy Authority. And then again, importantly, sort of Arctic communities and residents themselves. So just wanted to give people a feeling sort of for the breadth of who's involved in IARPC. So the next slide. So hopefully we're here today as members of the health and well-being team, or there's folks on the call that are involved in the next IARPC research plan. So again, the co-leads are myself, and then Sarah Yoder introduced herself. She's from the state of Alaska, and she's in charge of the environmental health program there. And then we also have Michael Banyas on the line, who introduced himself. So Michael joined the team within the last year, but Sarah Yoder was involved in the last Arctic research plan that went from 2017 to 2021, and has been involved for over, I think, like the last 5 years. So that's the health and well-being team, but I also wanted to give a quick shout out to the other collaboration teams. Most of the other collaboration teams are, primarily focused on the physical sciences of the Arctic and climate, and they're listed here. But like as an example, the marine ecosystem team in the last 5-year plan was very busy. So, and one of the things they do is monitoring the distribution abundance of Arctic marine species. Just as an example, the terrestrial team has been very involved in monitoring vegetation cover and terrestrial animal populations. And so while we're trying to focus input here today more on the human health realm of things, I just want to set it in the sort of context of all of these other collaboration teams. And these collaboration teams were sort of the main, I guess, driver behind the last Arctic research plan, and we'll look at sort of how that's evolving with this next one. So I just thought I'd stop there. Did anybody have sort of any questions about IARPC or the structure sort of? All right, then if we can move on just to the next slide, Meredith. So then I think people again are familiar with this, but IARPC organizes sort of its research, its collaborative research over into 5-year research plans. So the last one spanned from 2017 to 2021. And in the last one, the sort of research plan itself was written more around performance elements. And so the health and well-being team, which we are focused on today, had a very long list of performance elements in the last Arctic research plan. I think there was over 25. And again, IARPC, we try to focus the research that we're highlighting and working on research that particularly benefits from collaboration, whether that's between federal agencies or with our non-federal partners. So I just pulled out some of the research performance elements that went into that last Arctic research plan. And so just some of the ones, federal agencies along with ANTHC and other on-the-ground partners were busy supporting a One Health research approach. The Arctic, in particular, the Arctic Research Commission, along with other partners, was busy in sort of working on water and sanitation innovations. There was research on healthy homes and indoor air quality that was NIH supported and ANTHC primarily conducted. And then NIH supported projects on mental health, mental well-being was quite a prominent part of the last research plan. There were projects done by the Smithsonian Institute supporting, connection to cultural collections and anthropological and archaeology work. Some of that done at the Anchorage Museum. And then one of the performance elements focused on occupational safety and health. And most of that work was centered around safety in aircraft throughout the state of Alaska, and then also safety more in the fishing industry. And then one of the smaller performance elements was sort of focused on the expansion of telehealth in the Arctic. And those were NIH supported projects primarily that gave investigators funds to expand sort of clinical services out more into rural Alaska. So anyways, I thought it would just be useful to sort of review a little bit what we did in the last research plan before moving on to the next research plan. So next slide, please. So moving into the next research plan, the plan and the framework was published in December of 2000 of last year. And this slide sort of displays the schematic of the framework of the next research plan. And it's focused around 4 priority areas. And those priority areas are sort of shown in red here. And the these are the priority areas. Sort of the details of the research objectives and deliverables for each of these priority areas are going to be worked out over the next 3 to 6 months. And so all of these priority areas are having their own input sessions and trying to collect input from both federal partners and non-federal partners. And today we're sort of focused just on the one on the far left, the community resilience and health. And it's pretty easy to see that there's a fair amount of overlap between these, and that's being acknowledged and planned for as we proceed forward here. And then at the bottom of the slide are 5 foundational activities, and they sort of cross-cut across all the priority areas. And are super important and in the way we go about achieving sort of the research in the priority areas. These 5 overlapping foundational activities are just key to that implementation. And the foundational activities are something that are sort of ongoing, and they were involved in the last research plan, and they'll go further into the future beyond this research plan. And then on the right, so for this upcoming research plan from 2022, or we're sort of formulating it now to 2026, it's been split into 2 bi-year implementation plans. So there's going to be 2 two-year implementation periods. The first set of the implementation period, the first one is going to roughly cover 2023, 2024. And that's what we're starting to pivot towards working up the objectives for that first biennial implementation plan. And then there'll be a second one that's going to cover from 2025 to 2026. And so these 2-year implementation plans were sort of designed to narrow the focus into a tighter time frame, but also in hopes that we could be a little more responsive to changing needs like the COVID-19 pandemic during the last 5-year period. And hopefully a little more responsive to input from outside the federal government on what the research needs are going to be. So again, that's super important, these two-year periods, and we'll have different input boards here at the end of this that will focus on these 2 biennial implementation periods. So if you can move to the next slide, please, Meredith. So again, the BIP at the top of this slide is that biennial implementation plan, the objectives and deliverables. So objective being specific research actions, and then underneath those objectives in the plan are going to be deliverables. And so for the first 2-year plan, again, these objectives, we're just sort of moving towards starting to write or think about these objectives and deliverables. And so for that priority area 1, which we're sort of focused in on today, community resilience and health, the idea is that there'll be 2 to 4 sort of research objectives, and then underneath each of those objectives will be sort of the deliverables, 8 to 10 deliverables, the more detailed things on how are we going to go about addressing this objective. So, we're hoping to get feedback from the group on what people think that these research and objectives should be. And in addition to the listening session that we're doing today, we're also, there's been a lot of listening sessions that have been conducted. So there's been listening sessions done with the state of Alaska, with Alaska Native nonprofit groups and regional corporations as well. So if we can move to the next slide. No. Can you go back one slide? Okay. So this is the overall sort of goal of the community and resilience priority area number 1. And so the overall goal is to improve community resilience and well-being by strengthening research and developing tools to increase understanding of the interdependent social, natural, and built systems. So that's the overall goal for this, the priority area that we are focusing in on today. And then if you can move to the next slide. For the community resilience and health, we actually have both of the co-leads for that priority area are on the call today. And then we have 4 themes that are sort of being discussed within this priority area. And the themes are being left sort of purposely broad to allow for input during this outreach period. We didn't want to be too prescriptive on like, this is what's going to be done by the federal government. We wanted to leave it sort of broader. And so the broad themes are basically involving food safety and security. Both safety and security are evolving as an important research theme for this priority area, as well as the second one here is one that we're calling more public health and supporting the physical and mental health of Arctic residents. And then we have supporting the cultural well-being and resilience. And so that traditionally in the past 5-year plan was some of the work that was being done by the Smithsonian Institute, and then as well supporting research involving safe and reliable infrastructure relevant to human health. And then underneath all of these themes are sort of more specific ideas of what the research might entail. And at this point, they're sort of more examples of what might be picked up as we move into more of the writing of the 2-year biennial implementation plan. So for instance, I guess the one I know best coming from CDC is there might be research objectives and deliverables associated with the COVID-19 pandemic and preparedness for the upcoming years. There was a zoonotic disease prioritization done during the last plan. So there might be follow-ups from that, might be some of the research deliverables and objectives. And then some of the NIH supported work sort of in public health revolved around mental health services and mental health well-being. So we could imagine that the deliverables, the objectives and deliverables that'll be worked out in the next biennial, the 2-year biennial implementation plan might involve some of these. So I think we can move on to the next slide. And I guess although we are focused on priority area 1, which is the community health and well-being, there are these other 3 priority areas that there's other teams sort of working on. The Arctic Systems Interaction Team is sort of more of those physical sciences, with the sea ice and the marine ecosystem. So they're sort of working on more of those physical system interactions. The priority area 3 is the sustainable economies and livelihoods, and sort of looking at the social and built systems within the Arctic. And then the last one is the hazard mitigation and risk management. So there can be a lot of overlap, as I've said, between priority area 1 and all these different other priority areas. So when we get to these Jamboards that we want to collect input from, I don't want folks to limit themselves. I mean, I think we can go ahead and if an idea overlaps into another priority area, certainly go ahead and put it on the bulletin, the electronic bulletin board that we're going to be moving towards. And we'll make sure that it gets back to those priority area leads. So I think we can go on to the next slide. So we're hoping today, although we have a smaller group, to get feedback on what folks think would be important areas for, again, looking at that priority area 1 of community resilience and health, and looking sort of more at the human health research realm. So we're going to have 3 Jamboards. One of the first Jamboard will be more involved in collecting information for that first biennial implementation plan. So it's, basically covering 2023 and 24. And that plan has to involve sort of current or ongoing research that is either being conducted by the federal government or in partnership with the federal government or funded by the federal government. And we'll have the sort of, in the Jamboard, we'll have the 4 research focus areas that have been highlighted so far. And we're just looking for folks to put ideas for the research that they're involved with, or research that is in collaboration with the federal government on that first Jamboard. The second Jamboard is going to be more focused on future research needs and really sort of thinking more about that second biennial implementation plan that will cover 2025, 2026, and are there ideas for research, again, in the human health realm more, that we can pivot towards or try to seek funding for? And that might be identified in the first implementation plan, that we want to build opportunity to address these future research questions in the second biennial implementation plan. And then the third Jamboard will be asking if there's any ideas for questions for those other collaboration teams. So is there anything in the human health realm, research realm, that it would be helpful to get information from those other collaboration teams? And we'll list those out, but the sea ice team and the terrestrial team and the glacier team. And so, as IARPC is sort of a collaborative platform, we just wanted to ask the question, do you have any questions for these other collaboration teams? So I guess I'll just stop there and see if folks have any questions about sort of the 5-year, I guess the upcoming 5-year plan, and then this idea of these 2-year implementation periods before we move on. All righty. So Meredith, did you want to go ahead and orient folks to the boards?
Sure, I will do that. So in a moment, you will see a link come into the chat. I know that there are a couple of folks who are just joining via phone, and I'm sorry that you won't be able to participate fully through the phone. Luckily, those folks on the phone are also involved in the drafting of the priority area, so they can and know how to share their thoughts as well, and through other means. So here is a link to the Jamboard. Please let me know if it is not working for you. There should be 3 boards on the Jamboard. Dana outlined what each of those boards would be. And so I think we'll start with the first one. And there is the option for a sticky note. And that's what I suggest people use to answer and write the answer to, or your thoughts on this first prompt here, and then kind of stick it in the realm of the board where you think it applies most, or maybe in between, if it kind of fits in between some of these. And you just click the sticky note, type whatever you need to, hit save. You can change the color if you want to. It will appear on the board. So I'll just, for those of you who are on the board, show you what that looks like. Someone else has already done that. Great. And then you just can click on your sticky note and move it around. And you can edit it if you need to by clicking the 3 dots. There are 3 dots in the upper right hand of each sticky note. Delete it if you need to, other things like that. So if you have questions about how the Jamboard works, let me know and I will try to answer them.
And yeah, again, the 4 focal areas for the priority area 1 are in the black. So you can put your sticky notes, I guess, in the relevant corner, but also, I mean, we're still at a broad enough stage that certainly we welcome ideas too that don't necessarily fit into one of these broad categories. So, and we'll just keep this first Jamboard open until things quiet down on it.
And yes, again, feel free to just unmute and ask a question if you're not sure how the Jamboard is working. Just let Suzanne know, I'm going to send you a link to the Jamboard through your email so you can at least look at it there.
Thank you.
Thanks, everybody, for continuing to post ideas. I see some ideas sort of looking at some of the foundational activities as well, which is great to see. So one being incorporation of traditional knowledge into all discussions. I think I'll just give this board maybe one more minute here and then move on to the next. All right. Thanks everybody for those thoughts. And again, I think that this is research objectives, deliverables that we're more thinking for this first biennial implementation plan. So 2023 to 24. So unless there's anybody else that wants to add anything or anybody on the phone that wants to add anything, I think we can move on to the next board, Meredith. Or I guess we all do that ourselves, right?
Yes, yeah, at the top you'll see arrows like 1 of 3, 2 of 3. So we're moving on to 2/3
Okay.
now.
And so the difference between this one and the last one is just that focusing more on new ideas, things that maybe aren't currently being addressed by federal funding and or federal agencies or in collaboration with federal agencies, but things that maybe we could put in place some of the building blocks during the first couple of years that could then be more fully addressed and funded in 2025, 2026. So again, this idea that we have these 2 biennial implementation periods, we've split it out. And the hope is to make that more responsive to community and non-federal partners, but also to address emerging themes, emerging research needs. So this is sort of more, I guess, what I would call aspirational research goals. So we'll take a couple minutes here on this one to see if folks have ideas for fleshing out new research objectives.
And I just want to acknowledge Heather's comments about things on the first board belonging on this one as well.
Oh, great. Thanks, Heather.
I just want to acknowledge Rami, who just entered, and also David, who got here a bit later as well. We are working on a Jamboard. I dropped the link in the chat, and we're currently on the second board of 3.
All righty, and it looks like things are quieting down on this one, but I appreciate people sort of being willing to brainstorm and get a little creative with thinking about more aspirational research or things that we could build towards in the second biennial plan. So then if you want to go ahead and hit the next arrow, we'll move to the third, which is perhaps the most, a little bit, I think, challenging to sort of think about on the spot. But it's sort of, IARPC is a collaborative institution by nature, and we do have all of these other teams working on, they're listed in black up there. But it's sort of the question of, are there things that could be addressed or collaboratively addressed by these other more physical, I guess, climate science realms that would help in more of the human health community, both for the health and well-being collaborative team, but also for this priority area of community health and well-being. So if there are any questions that could be facilitated between these collaboration teams to address, again, human health research, then we'll spend a couple minutes thinking about that and posting questions to these other teams. And then over the next year or 6 months, we would try to reach out to these other teams. And this can be sort of thinking about the first biennial implementation plan, or, you know, thinking about things that might take a little bit of time to get up and going. So.
Dana, David asked in the chat why the third Jamboard says physical sciences. So maybe just clarifying that.
Yeah, David, that's just sort of my way of grouping these versus kind of human health, even though human health is physical as well, but sort of the physical sciences of climate related work. So I'm sort of categorizing like terrestrial ecosystems, permafrost, marine ecosystems, more into a physical science field, for lack of a better, but hopefully that answers your question. All right. Well, thanks everybody for putting some thought into that question. And we're sort of at the top of the hour. So I do want to thank everybody for their input. We at the Health and Wellbeing Collaboration Team leads, the idea is to have more monthly or bi-monthly meetings. And a lot of us have just been sidetracked a little bit on the COVID pandemic. But we do hope to jumpstart and start having more regular meetings. And as the next research plan comes out, hopefully start having meetings relative to these priority areas and the next Arctic research plan. So thanks for attending today, and we will hope to see you in an upcoming meeting. And as well, all of this Jamboard information, we appreciate your input, and we'll be getting that back to the people that are going to be moving towards writing up the research plan, the objectives, deliverables over the next 6 months, and in particular, our priority area 1 leads that were on the call today. We'll make sure to get this information back to them, but yeah, thank you very much. And did you have anything you wanted to close out with, Meredith?
No, I don't in particular, just wanting to allow anyone on the call today, if you have anything you wanted to say verbally, just going ahead and doing that in the minute we have left. Okay. And if not, I will end the call. I noticed Heather left and then rejoined. Heather, do you have anything you wanted to say before we close out?
No, thank you. Sorry, I just got kicked off.
Okay. Okay. Well, bye everyone. Thanks for participating.